Hi, welcome to Pregnant Possibilities. Sorry we're a little bit late. We're always having fun with technology. It's always special. I'm Jean Schumacher, and my partner is Dr. Deborah Shapiro, a board-certified OBGYN. And together we created the program called the Pregnancy Advantage. And our objective is to help women to get their bodies pregnant ready and provide support if you're having trouble conceiving. And exciting news, in case you haven't heard, Deborah and I are working on the Baby Advantage, which would pick up from conception and take you through the first year of your baby's life. You, not so much your baby, but you. So we're excited about that. And today we have a very, very special guest, Dr. Christina Miller. She is double board certified in emergency and integrative medicine. And due to her own health concerns, which I did an interview with her, which is absolutely fabulous, she radically changed not only her practice to lifestyle medicine, but how she's treating and handling her clients. And you can find her at plantbasedtelehealth.com. So Dr. Miller, thank you so much for taking the time to be with us here today.
Thank you, Jean, and thank you, Deborah. It's always my honor to be with you too.
It's fantastic to have you. It's really just a thrill to have an expert, someone who's working with different patients and clients all the time and is handling all different kinds of medical issues and with an eye toward lifestyle medicine and plant-based nutrition as well. So to get started, it is still Breast Cancer Awareness Month, and we have 3 more days for this. And we know that one of the big risk factors for breast cancer is alcohol consumption. And it just seems so commonplace now for women, especially now during the lockdown and COVID. There's a lot more day drinking going on and just more drinking in general. I've been hearing from my patients at work that they're definitely drinking more. It seems very commonplace that people are drinking almost daily. Of course, we recommend if someone's trying to get pregnant, just to stop entirely because there's no safe amount in pregnancy. But I was wondering if you had any thoughts about alcohol use, either from your days as an ER physician or as you're practicing integrative medicine. What are your thoughts about alcohol consumption?
Oh gosh, I have so many thoughts about alcohol consumption. So first of all, one thing I would say since you asked about, since my days in the emergency room, one thing we notice is that when people are drinking a little bit more, if they have any liver issues at all, and remember that for a woman, the recommended amount is 1 drink, and that's 5 ounces of beer. That's 1 ounce of hard whiskey or hard alcohol, and that's, I think, 8 ounces maybe of beer. And for men, it's 2, double that. And the reason that it's so small is because our livers metabolize it into a metabolite that is actually toxic, acetaldehyde, to our bodies. And so it uses up our resources in our liver, our antioxidant resources like glutathione and NAC, which is why in the ER we give people things like NAC. We find people to be vitamin deficient, B vitamins, B1, 2, and 3, niacin. So we hang these what we call banana bags in the ER, which are yellow fluid bags, which with glucose in it and with these B vitamins in it to replenish it. Some folate is in there. And so people are drinking at home and we're trying to be as healthy as we can. Maybe it's for pregnancy, maybe it's to prevent breast cancer, maybe we're just feeling stressed out because of the world right now. And we're drinking alcohol, so we're putting a actual toxin into our body, which we can metabolize that little bit, and some people metabolize it maybe a little bit better than others. But it's really hard on our livers, and it does utilize our resources, and people can be vitamin deficient. So my overall view of it is I'm not really that big of a fan. Of course, I see all the trauma from it and the car accidents, and it's very dangerous, and it can lead to heart dysrhythmias like atrial fibrillation, and I've seen lots of that as well. But as far as breast cancer awareness, it promotes breast cell growth, right, because of the estrogen. So any amount of alcohol has actually been shown to contribute to breast cancer. So I counsel all my patients, we all have different risks. We all take different risks in this world. We all have different views on how we want to live and what our goals are. So, but if someone tells me that their goal is to really prevent breast cancer, maybe they have family history or personal history, or they're just scared of it, or they, it's important to them, then the answer is no alcohol for that person. Maybe someone has a long history of their parents living, breast cancer in their family, they live and age well, and that it's not really been a concern for them, then they, it may be okay for them to have that glass of wine here and there. So I do modify it for each person, but certainly it's a risk with breast cancer awareness, and it's hard. It's very challenging. It's something addictive. We're using it to relax. So without other tools, it's definitely, I'm not saying this is an easy thing, but I do counsel my patients about this.
I had never heard that about NAT. What is NAT? Does that stand for something?
Yeah, sorry. So NAC is N-acetylcysteine, and it's a precursor to glutathione, and it's in cells throughout our body, but especially in the liver. And so in one thing we see people with acetaminophen, high amounts of Tylenol toxicity or acetaminophen, which is the #1 cause of drug overdose, unintentional drug overdose, because people don't realize they're taking too much, or combined with some alcohol. All these are liver toxins. There's so many other things that the liver is constantly trying to get rid of. Pharmaceuticals, it's constantly trying to do them. They become additive, and it needs the glutathione to turn it into a non-toxic compound and get rid of it. And so in order to have enough glutathione, it needs the NAC. And so when people come in, maybe mushroom toxicity, maybe Tylenol toxicity, maybe alcohol, we're giving them this NAC IV, and it's a major antioxidant, and it helps their liver. It kind of ramps it up. So
fantastic. Oh, thank you, Dr. Miller. I did not know that at all. I mean, I just didn't know all the details of how the liver would detox. I mean, I know about phase 1 enzymes and phase 2 enzymes. I guess that's one of them, right? So,
right.
And we know that sulforaphane from cruciferous vegetables increases the phase 2 enzymes. I don't know whether NAC is one of the phase 1 or phase 2, but anyway, it's all part of it. And thank you for elucidating that.
NAC is actually an antioxidant, not an enzyme. So it's kind of involved throughout the whole.
Fantastic. Thank you. So wine, we're talking about like one glass of wine, one sort of taller glass of beer, or one shot of liquor, and it should not be more than one a day, because you really are increasing your risk of breast cancer. And this is more of a coaching question for you, but if a woman says, it's alcohol is what I use at the end of the day to sort of switch my mind off from work to relaxation, and people come home from work and they have a cocktail, and I mean, lots of people do this. So what would you tell someone who's really trying, they want to stop that, but what else, how do you handle that? What else can they do to, instead of using wine to unwind, for example?
So it's very challenging, right? Once we build habits for something, it's really hard to break them. And it is challenging if we don't have tools to help us relax. So first of all, I let them know that I understand that this is challenging. I'm not asking them to do anything easy, but if this is something that's important to them, and we talk about why it's important, what their goals are. So that's first and foremost, to understand our goals. And when we make our goals something big that gives us meaning, that's helpful. So once we have that in place, then we got to come up with a plan. So we got to anticipate that, okay, right now we're at an appointment and they're inspired, they're motivated, they want to do this, but as the day wears on, they know they're going to feel the stress and the habit, and they know it works for them. And so we have to build a plan ahead of time, so we anticipate it. So what can we do instead? Well, there's evidence that things like deep breathing and meditation, or body relaxation techniques, that this calms down the sympathetic nervous system, puts us more into a parasympathetic, we might have stronger tools at the end of the day. So now when we're not feeling quite as high, oh my God, fight or flight, nothing else will help me but that glass of wine, maybe we're at a lower state. We're still in it. I'm not saying that's the only thing we're going to do, but that's one step. So incorporating these into our daily, and I really think it's important to start the day with something. Maybe it's 10 minutes of the yoga, gentle movement that you can do. Maybe it's deep breathing, maybe it's a meditation, whatever works for each person. And then again, through the middle of the day around lunchtime, like after this talk, because this ramps me up. And so after this talk, I'll do my own few minutes of deep breathing and reset myself, so that by the end of the day, I too have my own weaknesses, and mine tends to be more food related, but I have them. And so I will do my deep breathing, and now, so that by the end of the day, I'm in a calmer state. And then the last thing I would say is exercise. So whatever people can do, some people can't do a lot, but we just do movement in our chairs. But exercise really helps clear some of the lymph and the toxins. And it also helps increase our endorphins, our feel-good hormones. And it's been shown to be helpful. So it gives us more of that motivation, that strength that we need. We always feel a little better after exercise. Or a new ritual. Maybe at the end of the day, instead of your wine, maybe now you can go for a walk around your block, social distance with your mask, but you can go for a walk around your block and have a new ritual. So start just start out, maybe you have to get rid of the wine in your house. Maybe, there's different tricks we can work on with each person. So
in the garage, I put a hot tub in there called a Softub. Empty, it weighs like 50 pounds. And what's awesome about it, you can take it out and move it outside, like in the spring, summer, fall. And then when it gets a little cold, like now, it comes back in. And so it's fabulous that you can move it around. But what's great is it plugs into 110. So you don't have to rewire, because most hot tubs take 220. So this is awesome because I have a tub of hot water, Calgon, take me away. Okay. That's
a great tip right there. It brings you right back into parasympathetic, which is what we want to do. Lovely.
Dials it down. And the other thing I have is one of those rebounders. That is fabulous. What you were talking about, getting the toxins out of you, and just go. I've got the rebounder, in a place where I can just pull it down really quick and just start bouncing. Well, I'm sitting on a ball too, but that also helps because I do during the day, like what you were saying, like after I'm done with this call, I'll take some time and do a few exercises on the ball, and just get my blood flowing after I'm done. And so, yeah. And then tea is my favorite. Oh my God. There is a lemon glazed tea, and it's caffeine free. There's no sugar in it, but it tastes like you're sipping a lemon cake, one of those glazed lemon poppy seed kind of things. And it is fabulous. And that is my
I love that.
My day.
I feel more relaxed just listening you describe it.
Well, I just remember having a mother who was British, and she's just like, life just cannot be too bad if you have a cup of tea in your hands, because
I love that.
That means that you have tea, that you have something there, that you have hot water, that you have a pan to cook it in, that you have a stove to heat up that hot water, you have a mug or a glass. I have these double-walled right here, these. And I love that because you can put hot or cold in it, when you're drinking your tea. So it's fabulous. So that I love. And I just love seeing the tea in that, and it just brings me right down, and it just chills me right out. And it just, that's how I decompress and stress out, de-stress. I've never been a fan of alcohol. It just does not make you feel good. I mean, honestly, it's a toxin. Bottom line. You can hear all the research you want, and dig into it. Because if you go on the internet, you're going to find something that says, hey, drink alcohol, it's going to extend your life. To the other end, that it's, poison and it's a toxin. And there's everything else in between. You ultimately have to make the decision how it feels on your body, but like Deborah said, if you're trying to get pregnant, no.
Or prevent breast cancer, right? Two reasons. Those two are exceedingly important.
Well, if you're just trying to heal your body, you just don't need this.
Right.
You just don't need this.
And from my level, I do a lot with the microbiome, and so it also damages your microbiome. So remember, we use alcohol right now. We're using 70% alcohol to clean our hands, alcohol sanitizers. Well, we're drinking alcohol, so it definitely kills off and damages our microbiome, and we see an alteration of people. And so people with autoimmune diseases or any gut issues, or people with kind of anything inflammatory, when we're trying to heal them, it's never part of a healing plan. Some of my patients will feel so much better in repairing and do so well, and then they may bring it in. It's everybody has their own personal choice, but I always remove it as part of a healing plan. So
that makes a lot of sense. It's interesting because there are blue zones where they don't drink, like in Japan, in Okinawa, but there are also blue zones where people do drink alcohol in like Sardinia. And so it's not absolutely a game changer in terms of longevity, but I think it's very important to remember that it is a group 1 carcinogen, right? So, right. And a toxin and damaging to the liver, and as all of the things that you said, also to the microbiome, and it's addictive, right? I mean, that's the other thing. It's a slippery slope, and you start having a little bit, and then for some people it could accelerate and become really a problem. So
plus, it's not the best way to be coping with the stressors right now. I'd rather people be doing some deep breathing, having some tea, and rebounding and resetting their their sympathetic nervous system, versus drinking alcohol, which in the long run is going to leave them nutrient deficient, the liver depleted, and microbiome destroyed. So it's pretty extensive what it can
And
do.
it affects your sleep, and it has an adverse effect on your sleep as well, which is going to have a terrible effect on your immune system and your ability to lose weight, and it increases your girth, your abdominal fat. So just
Absolutely.
there are a lot of reasons not to, but it's still being used, and it's probably contributing to that like COVID weight gain that people have been talking about too.
We have a question on deck from Sis and Robin. Thank you for joining us today. For breastfeeding moms, do they need to really pump and dump?
Around alcohol use? Is that what you're asking?
Like perhaps if your breasts are too engorged, and Sis, and if this is what I'm interpreting, you might just correct me. So if your breasts are too engorged, should you pump that extra milk out if your child is not ready to consume that milk at that point?
Well, do you want to answer, or I?
No, I absolutely don't want to answer that. That's all you, Deborah. And I'm very curious too what your answer is. So.
Well, if you have extra milk, you should pump and save it and freeze it so that one day when you want to go out to have a spa day, someone else can feed the baby breast milk. You should definitely, if you're engorged, you should empty the breast. There's no other way. I mean, unless you don't want to breastfeed anymore, and then you need to compress them. But I don't think that's the question. I have a feeling it's a question around alcohol.
Anything that's toxic. So she just added that comment in. So
yes, this is a very big question. If you are putting something in your body that is toxic, then you should not possibly not be breastfeeding. So this is an issue, and I think you need to talk to your clinician about what you're taking in to decide, because there are certain medications, like even SSRIs, there are certain medications that you would want to breastfeed first and then take it. There are things that different medications have different half-lives in your body. And that can be important when you're trying to figure out when to take the medication and when to breastfeed. So you may have to dump some, if you have mastitis and you have to be given a medication for a week, let's just say a week or 10 days, like doxycycline, it's absolutely toxic to the baby. You cannot give that. Then you have to, yes, that is a time when you would need to pump so that you continue to make milk. Because if you don't pump, the milk will go away. So you have to pump, but you can't give the baby that milk. So yes, I would say a qualified yes. There's definitely times when you're bringing something into your body for a good reason that is not safe and has a half-life that's going to interfere, that's going to be there in the breast milk, and then you would need to discard it. But otherwise, now with alcohol, Chris, I'm not really sure. Really, I would not drink when I'm breastfeeding, but I know a lot of people do. So I think it may be one of those times when you have to decide how long that alcohol is going to be. You certainly don't want to be drinking and breastfeeding at the same time, although probably our mothers did it. But I wouldn't. I absolutely wouldn't. Chris, do you have any idea about the half-life of alcohol?
So my approach to that, if someone asks me, is I would go to the literature and see what it says, what they recommend, what they find. Is it transmitted over? Is there any evidence it affects the baby that, as they're growing? My guess is that it does, and I feel like I've seen that, but I don't know for sure right now. So I would look at that closely, and then I would talk to them specifically and say, hey, this is what we've seen, or even if it's not known yet, but it's a potential risk. And I would say, let's not give your kiddo that risk, and maybe it's an issue that mom can't not drink for a little bit or splurges or, and so we would have to talk about it on a little bit different level, but I would go to the data and try to present it to that person like, this is what it's been shown that it can do.
Right. You can also ask the pharmacist. I mean, pharmacists also know about the half-life and what might be safer. But I think this might be a time, if you know that you're going to be, partying on, even like New Year's Eve, you're going to be having some drinks, then maybe that's when you have some milk that's been saved that you can give the baby that will not have that alcohol in it, because really it is a neurotoxin too, right? I mean, you just don't want that to go into your baby, but certainly for antibiotics.
But even still, not just things like alcohol, and these are things that we discuss and talk about in the Pregnancy Advantage, things like personal care products, like you mentioned, Doc, about, we're now putting a lot of alcohol on our skin, and some of those chemicals are pretty toxic and depends upon the hand sanitizers and what you're getting. So not all hand sanitizers are created equal, and I just want to get that out there. Some of them still have triclosan in there, which is a banned substance, and it's like, are you really? So, so stuff like that, you really have to be aware of, especially if you're breastfeeding, because this is what you are feeding your child. And this is the sustenance that you are giving. So you want to make it the best quality, which is one of the reasons we talk about trying to get your body cleaned out and ready before pregnancy. So Sisson also, she said, I was told to take a narcotic for a tooth infection and that I should still nurse him. So it was Tylenol with codeine.
Right. I was just thinking about that because I was thinking about when people have C-sections and they're on narcotics for a little while. Now, it's true that your milk doesn't really come in for a few days, but there is the colostrum, the early milk, and that probably still has some of the narcotics and metabolites of those. So, you could decide, I don't know how old the baby is and how often you have to breastfeed, but I mean, I suppose if you're taking it all the time, if you're taking it every 3 to 4 hours because you need it, well, I'm hoping you don't need codeine every 3 to 4 hours, but if you do, then there isn't much you can do, right? You need to breastfeed. If it's possible to breastfeed before you dose yourself, and then you have a few more hours so that the level can go down a little bit before you need to breastfeed again, then that's what I would do. But I wouldn't stop. I mean, I guess we feel that a small amount is okay because we certainly don't forbid women. We send women home after C-sections with narcotics. What do you think? Chris, do you have a feeling about that as well?
No, I agree with that. Sometimes there's just so much pain, and I think they do well overall. If you just keep it to a low dose, a minimum dose, you understand there's always a potential risk, and you're doing everything else you can. I always say, though, what else can we do to reduce pain? So, I had a tooth pulled because I had a ton of cavities as a kiddo, and I iced it. I put local ice on. Somehow icing my chin. I did some deep breathing, listened to music, and all of that, like listening to music has been shown to reduce pain, and people post-op actually require less pain medication. So I actually didn't need to take anything after getting my tooth pulled, and he prescribed me Percocet, like strong narcotics.
Oh.
I knew I didn't want it, and I didn't need it. And so, and I anticipated I would have some pain because I just had a tooth pulled. So I was like, okay, this is good. My body's healing. It got rid of this bad tooth, and I just kind of talked myself through it. And not that everyone can do that. Everyone's pain is different, and I don't know what's going on. So I totally get that. And I would take something if I needed it. I absolutely would. But, we can also do these alternative tricks a little bit. And then maybe we need less medicine or for a shorter time, or maybe then it's just Tylenol, so there's using a combination of things might be helpful as well.
Right. Yeah. There's lots of things that we can't control, but whatever you can, just to keep the baby as safe as possible. But sometimes you just have to, going to have to.
Because having a lot of pain is also a stressor, right? And that's going to change your stress hormones, and that is going to, that's reflected as well. So I don't encourage someone to be miserable and in a ton of pain either. So that's, then I would rather than take the Tylenol with codeine, just try to take as little as they need to get them out of that phase.
So, in the Pregnancy Advantage, we're really trying to maximize nutrition before pregnancy and during pregnancy. And I'm trying to encourage this. We talk about the nutrients of concern, trying to encourage optimization of all of this, but without taking this reductionist view of nutrition. And I feel like where we, measure, people are kind of freaking out about every micronutrient, macronutrient to be sure they're meeting some standard. And it is really, this is a time of great anxiety, and women need to know that they really need to feel that they're doing everything as right as possible. And, it's so funny that when people are eating, when I was being an OBGYN and women were eating animals, we told them to take a prenatal vitamin, and that was really it. We never really thought about it at all. But somehow when people are not eating animals, we're worried about everything. It's just ridiculous, right? So I just wondered if you had any words of wisdom for women who are super concerned about their nutrition before and during pregnancy. Do you think that vegan women should consult with a vegan dietitian once or twice during their pregnancy to make sure that their diet is optimized?
Well, I agree with you in that I don't like the idea of a reductionist view where you focus on every little thing that you're eating. That being said, especially if someone's concerned or pregnant or about to be pregnant or breastfeeding, and someone else's life is also, it depends on what you're eating and how you're living. Well, I think it's good to be mindful of that and pay a little extra attention. Maybe back in the days, nobody ever did. Most of us turned out okay, but I might have been better off if my parents had eaten a little bit better before my mom had eaten a little better. So who knows? I would recommend that if they're confused or they're not certain or they're kind of new to this, that they work with someone, at least initially, to get an idea of what a balanced plate looks like, to make sure they're getting enough amino acids. Because you could be vegan and eating junk food vegan, right? You could be eating chips and salsa and stressed out and you're eating vegan food, but you're not getting the amino acids that you need, and or that you're not getting the vegetables. We need the folate, and so we make sure that we're getting vegetables and that their immune system is doing well. So I would say whether they work with someone like you guys with your programs that you have to offer them just to teach them how to do a basic plate. If they need more, absolutely, whatever people need, we're all different. So if someone's interested in talking to a dietitian, as long as it's someone who's knowledgeable and well-balanced plant-based eating, then that can be helpful for that person. Does everyone need it? No, absolutely not. If people are pretty comfortable with it, they feel good, their energy is good, they're thinking clearly, they're doing well, then I think they just follow up their OB and make sure everything's okay. Take the or the prenatal vitamin as recommended by their OB doctor. And each person is different. So if they are worried or they're not certain, I think it's not a bad idea to make sure that they have a balanced plate. If they feel okay and they're doing well, I don't think it's absolutely necessarily. That would be my thought, but you guys do a lot with pregnant women too, so I'd be curious what you think about that.
No, I agree, but I was wondering, are there that's not something that you do as sort of an internist, well, or do practicing internal medicine. And I don't think that the plant-based telemedicine, there are no vegan RDs in your group, right?
No, not yet. There may become someone, but I do look at what people eat. I have them write out exactly what they're eating and make sure that they're getting enough of everything that I'm concerned of to make sure. And I look at that for all my patients, because just because we're eating plant-based does not necessarily mean people are healthy. So a lot of people aren't thriving. Maybe they're not getting enough omega-3s. Maybe they're not absorbing enough zinc. Maybe they have some gas and bloating and they're not getting all their nutrients in. So sometimes I'll do nutrient testing, but not on everyone. Number one, I look at symptoms and how they're feeling and if they're thriving. And then if they're not, we'll start to dive deeper. I always look at what every one of my patients is eating and make sure that we're getting a diverse enough diet. So I do a lot of that. That's actually exactly what I do with people.
Oh, so we can actually refer people to you.
Mm-hmm.
Oh, wonderful.
And it's certainly if people aren't thriving, because what I've noticed is, we're all about plant-based diets and we think it's going to fix everything, but it's not a panacea. And so people are different and people come from areas where our guts are not absorbing or they're damaged or the microbiome's way out of balance. And just because we eat plant-based, some people get worse initially or they struggle or it takes a long time to repair that, or we got to do certain supplements, or, they're just not getting enough and they're not thriving. And so I love helping people tease that out and really, whether we check blood work, whether we just do it comprehensively by going over everything about them or they're past everything, all their testing that they've had in the past. And so we come up with plans and each person, it might look a little different, certainly depending on that person.
I call it peeling back layers of an onion, because in the beginning, most of us are so toxic and we need so much to heal ourselves. And it takes so much time that we really don't understand for a while, like issues that we've been dealing with or struggling with. Like for me, it took me for a long time to realize how salt sensitive I was. And that I really had to eliminate all salt for processed foods. Makes it virtually impossible for me to eat out unless I know going ahead or know going into it that it will raise my blood pressure without question. So, and it takes about 2 to 3 days. If I do eat out, it takes about 2 to 3 days for my body to go through and flush out all the salt and the sodium from the processed foods, because especially like things when you eat out, like soups are one of the worst things that you could possibly get because it's so phenomenally high in sodium. And so, restaurants are not there to help you, help your health journey. They're there to make a profit, and yes, provide a service for you. And it is nice to eat out, I'm not going to lie, but it's at a cost to you physically. So I think there's just little things that we have to learn to peel back and start, adding other features like we talk about all the time, like extras of the pillars, exercise, you need to have a good night's sleep. Well, speaking of sleep, I just got to share this with you guys because this has been a big one for me, because I started snoring and, my husband's not a real fan of this. I'm just saying, So now I've tried a lot of things to help, and even like my weight loss has helped my snoring. It's dialed it down. But I just started taking tape, and I've heard about this, is you tape your mouth closed. And so I did that last night. I just took like paper tape, like surgical tape, and put it right over my mouth, and my lips stayed closed all night. And there's a lot of information about this. So like just little strategies. I had no idea. I heard about this from a good friend, and I had no idea about this. So I tried it last night. I probably got the best sleep that I've had in a long time. I went deep. I could tell. I woke up refreshed. My feet hit the floor. Normally I'm pretty, upbeat anyway, but like, wow, I got out of bed this morning. I jumped out and I'm like, yeah, let's go. And I'm like, wow, hadn't seen that.
That's awesome. No wonder you're glowing over there. Now we know your secret this morning.
I don't sleep. Who knew?
Yeah, no, that's good. There is some good data on that, to tell you the truth. So, and when you breathe through your nose, it warms the air, it purifies, it clears it, and that's the better way to do it. It's optimal. So, and it prevents that whole snoring, the epiglottis from falling backwards. And so, I have several patients trying just a little bit of tape. Some people have sinus blockage or allergies or something, and they'll feel suffocating. So I always tell people to just put a little bit at first, because it can definitely cause stress in certain people. But you're a great testimony. I love listening to you tell us how great you feel and how much it works.
The other thing that I used, and I just happen to have some here because I use this all the time. I used to be the queen of Vicks, like growing up, Vicks Vapor Rub. Well, I'm not even going to go into the details. So I found Pure Haven has this Breathe Pure Vapor Rub, which kind of like replaces my Vicks. And I know it's like not toxic. So I put some of that in my nostrils. It opens up my nostrils, and then I can breathe. So, so I don't have the issue. So I can tape my mouth closed.
I love that. That's a good trick, actually. I haven't recommended that.
Win. My husband's like, are you okay? Like a couple of times he like wanted to come over and like, I don't know, what is he going to start complaining now because I'm not snoring? I can't sleep without you snoring, I don't know. You can't win.
I love that. That's such a good story. Yeah. Great.
So it's really completely safe to do, even unless there's a sinus problem, like even if you have sleep apnea?
Yeah, no, it's safe to do. But I always tell people to try it first, like lay down for a little bit, see how you feel. Sometimes people, when they lay down, they feel like they're suffocating, and then it's not going to work for them.
Okay.
If they have too much anxiety, having the mouthpiece, or a lot of people can't get good air into their noses. And so I have them do a little tiny test first, and to make sure they're okay. Maybe just lay there for a little bit, or breathe that way for a little bit before you lay down. After that, it's okay.
But I can't tell you how much I have spent trying to deal with my snoring, apart from like going to surgery or something like that, whatever. But I've tried all the, buy this for $19.95, whatever. I've tried them all. And this was like the only thing I'm like, oh my God, who knew?
Wow.
So Jean, I actually tried it too, because I get dental caries pretty easily. I have my whole life, even going plant-based, I still get dental caries. And so one of the things is I'm a mouth breather. And so they always said, and I for a while I had some sort of allergy in my nose. I couldn't breathe well. So that's why I was an example of that, but it cleared. And so I started doing just that little bit of tape, and I haven't had dental caries, knock on wood. I don't want to jinx myself, but so it is truly beneficial for a lot of different reasons if people can tolerate it. That's the only thing I say.
Yeah. No, it was a little annoying, and in the morning I left the side of it like flapped over so I could just go and I didn't go I went gently.
Yeah. I'm glad you don't have any red lips today from the tape.
Well, and I found something on Amazon, of course, that it was a little bit more, not as sticky as the paper tape, but hey, that paper tape, you go down to whatever box, CVS, Rite Aid, whatever you got, just get some of that paper tape. That worked just fine.
I recommend actually the paper tape, because it is a little less sticky. And I say that on purpose. You don't want it to be like really pulling your facial hair out, or, damaging your skin. There is actually a product online, I've looked it up, where they target it for sleeping at night like you were describing. So it's made pretty fancy. It's pretty expensive though. So why would you spend that much money? They're like strips that you put on. Yeah. But I agree. And I would definitely go with the paper tape over other tapes because it's not a stick.
Well, I'm not thinking like duct tape or anything, you know.
Well, I don't know. I just want people to know, because they may say, oh, well, that's what I happen to have. I'll just use this duct tape.
No.
Yeah.
That's going to take off like the top like 30 layers of your skin and not be pleasant to take off. So I didn't find it. I went slow, you know, but I did leave. I folded over a side of it, you know, the tape, so that I had a little like something to pull off in the morning. But it was amazing. So, Dr. Miller, thank you so much. You know, we could spend hours talking, and we always do. So thank you so much for taking the time to be with us.
Thank you. I can't wait until next time. And how can people reach you if they want to consult with you?
I am on plantbasedtelehealth.com, how they can join on and make an appointment with me. So,
what states are you certified?
I am certified in 19 states, so you'll have to look online because I don't know if I know them all offhand. I currently live in the East Coast in New Hampshire, and hopefully if I cover you, I would be happy to help anyone who's interested.
Fantastic. Yep. Thank you so much. Thank you.
And we'll be back again.
Thank you, guys. It's been great.
Yes, absolutely. Fantastic. Thank you. Thank you.